A liquid biopsy is a non-invasive test on bodily fluids such as blood. In patients with advanced stage cancer, tumours shed genetic material into the bloodstream, which can be detected by a liquid biopsy. The liquid biopsy test can provide the current genomic profile of the tumour without the delays and complications associated with tissue biopsy. Based on the current genomic profile of the tumour, doctors can recommend the most appropriate treatment for their patients with advanced stage cancer. Patients who have advanced stage gastrointestinal cancer or GI cancers can benefit from liquid biopsy, especially if there's not enough tumour tissue available for biopsy. It is also recommended for patients whose cancer is progressing and are seeking personalised treatment and who want to avoid invasive, repeated tissue biopsies. In certain GI cancers, such as pancreatic or biliary tract cancers, also known as cholangiocarcinomas, it may not be possible to assess the tumours due to its location. For patients whose cancer has advanced and spread to other parts of the body, time to treatment is crucial. Comprehensive liquid biopsies can identify cancer biomarkers faster. Traditional tissue biopsies require logistic arrangements for the procedure, and the tissue needs to be processed and then read and reported by the pathologist. Usually only after these steps are completed can a request be made to commence sequencing work on the tissue. For liquid biopsies, once the blood is drawn, arrangements are made to be sent to the lab for sequencing immediately. Comprehensive liquid biopsy may also detect uncommon biomarkers that may not be detected by tests that check for only specific biomarkers, thereby providing more treatment options, especially in cancers of the pancreas or biliary tract. There are now approved treatments that can be used to treat these aggressive cancers. While choosing a liquid biopsy test, there are some important considerations. For instance, is the test approved by the US Food and Drug Administration or US FDA? Is it validated by oncologists globally and supported by reliable evidence? The test should be able to detect relevant markers in cancer treatment. Additionally, the accuracy and the turnaround time for test results is also taken into consideration. Discuss with your oncologist to find out which liquid biopsy test is right for you. I have an example of a patient who benefited from using liquid biopsy. He has metastatic colon cancer and he had progressed on his first-line treatment. We were using chemotherapy together with targeted therapy as his initial tissue biopsy had shown that he did not have a resistant mutation. Now, subsequently, when he progressed, we were wondering what to use for his second-line treatment. Should we continue on the antibody and just switch chemotherapy? So, we discussed about tissue biopsy, but he was reluctant for an invasive procedure. A liquid biopsy was performed, and it actually showed he had developed secondary resistance with a mutation known as a KRAS mutation. Therefore, we proceeded on with chemotherapy and switched the antibody. I'm happy to say he responded very well to his second-line chemotherapy.